So you're in for a checkup. First, we're going to check out your head, neck, ears, eyes, nose, and throat. So I'm going to start at your head. I'm just going to look at your scalp, make sure there's no lesions inside or on it. Make sure there's no flaking of the skin, and make sure there's no tenderness. So does anything hurt?
No.
Okay. All right. And then we're going to do your skull. I'm just going to feel your bones and also make sure there's no tenderness or anything. Let me know if anything hurts you. Nothing?
No.
Okay. Alright, so I'm going to look at her face, see that her eyes are symmetrical, her nose is symmetrical, her lips are symmetrical, and everything looks okay. So I'm just going to palpate your face and just make sure there's no tenderness around anywhere. There's no poofiness, sorry about that. On the lips. Okay, anything?
Mm-mm.
Okay, now I'm going to Okay, I'm going to test your mandible. If you can just open your jaw for me and shut it. Any pain? I don't feel any sensations of popping or anything, so that's good. We're going to inspect your nose. So if you could just look back for me. I'm just going to look in each nostril, make sure none are occluded. Sorry, it's a little bright. Okay, so her nostrils symmetrical, nothing was occluded. So we're going to move down to her mouth. Since we already did her sinuses, we did her maxillary sinuses, frontal sinuses. She had no pressure on those, so we're going to do her mouth. So if you can just open your mouth, I'm just going to inspect and make sure that there's no lesions, nothing looks red, tender, bleeding. If you could say ah. Okay, excellent. And I would normally have a tongue compressor, and I would compress her tongue down and have her say ah, so I can see a little more, and also feel if there's any other tender spots. So now we'll go down through the neck. When I inspect the neck, I'm going to start from the back. I'm going to move your hair, I'm sorry. So I'm going to go right down the neck, and I'm going to do one at each time, or one at a time. And I'm going to feel for any lymph nodes that are large, enlarging. Any tenderness, let me know. Anything?
No.
No? Okay, I'm going to check the other side. Anything?
No.
Okay, and I don't feel any enlarged lymph nodes. So now I'm going to palpate your thyroid gland. I'm also going to do this at one time, so I don't include any arteries. So the thyroid gland's right next to the trachea. It goes down and around the front. So I'm going to palpate this side, and then you can feel it right there. And I'm not going to press too hard because you can release some hormones while you palpate it there. And then I'm just going to check the front, make sure it's not swollen. Okay, good. And then I'm going to check the front. And I'm just going to look at it, and I'm just going to feel around also and make sure that she doesn't have goiter. It's not enlarged, it's not anything, so it looks good. Also, when I checked her hair and her eyebrows, I was seeing if she had any hair loss, because that could be a sign of hypothyroidism or hyperthyroidism. So now, while we're at the neck, can you just rotate your neck around in a circle? Okay, good. Any pain?
No.
Can you flex it back? And now flex it forward. I guess extend it back, flex it forward. Any pain there? Okay. So we inspected the thyroid. Now we're going to auscultate the thyroid gland. So with the bell of my stethoscope, I'm going to auscultate her thyroid gland. So I'm just going to over it. Maybe take a breath. Okay. And then take another breath. Okay. And so I was listening for a bruit, or a bruit, that's actually the term. But you would hear it would sound like an air would go through, and that's something you do not want to hear. So we inspected your lymph nodes. The tonsils, as I would said when we looked in her mouth, we would see her tonsils, see if they're enlarged or anything. Checked your mouth. Also, when I looked in her mouth, I saw that her mucous membranes were moist. They were pink, and that goes as far as her lips, her tongue, her gums, and her throat also. So I'm just going to check your ears. If you could pull your hair back. Thank you. And I'm going to check and make sure they're symmetrical. Sorry, I'm just going to lift it up. Ears look symmetrical. Okay. And then I'm just going to cover one in the back. I'm going to do the whisper test. Say, can you hear me? And I would whisper it quieter, but for the video, I'm going to do a little louder so that she can hear me. Can you hear me? Okay. All right. So she was a positive whisper test. So we're going to check. I think we're doing the PINA in class. We did the whisper test, so we're going to do the eyes now. So I'm going to check your eyelids first. We already looked around her eye and saw nothing was poofy, so we're going to look at her eyelids and make sure that they look good. Her conjunctiva looks good. Everything's white. So now we're just going to check if you can just follow my pen. We're going to check your motor skills. Okay, and down. Okay. All right, and then if you can just look at my nose. Okay, and I'm checking the reactivity of your retinas, which was all good. Okay. We're doing the gazes in class. All right. So now I'm going to check your skin. So I already started assessing her skin when I first walked in the room. I could see that she's not sweating. Her skin is intact and dry, both her arms. They're symmetrical. I would also inspect her legs, but she's wearing pants, so I'm not right now for the video. But I would make sure that she has no lesions, nothing, no masses, no random bumps or bruises that showed up randomly. So I would check those and make sure those are okay. Also, she doesn't have much arm hair, but on a patient that would, I would assess their arm hair and make sure it's not patchy, make sure, again, it's symmetrical and that they're not losing it from anywhere in their body for some random reason. Okay, so now we're going to go on to the heart and thorax. So, again, when I walk in the room, I'm going to assess her, how she's breathing. I can see that she's breathing evenly. Her breaths are non-labored. I would count her breaths when I do her vital signs, which was in the last video. She's in a sitting position. Her posture is good. She doesn't look like she's using any external muscles to help her breathing. I'll get her rate and rhythm. Also, when I did her vital signs too, but I'm going to take a listen. So I'm going to listen in the back first, and I would do skin to skin, but for the video, we're going to do right on top. So I'm going to... Alright, so I'm going to start on the left side and work my way to the right side. So Nicole, if you could just lean forward a little bit for me and take a deep breath. Okay, then I'm going to go to the right side, and then I'm going to go down, and then again, and then the right side, and then down again to the next lobe, and then the right side. Good. And also, as I do this, I'm checking for to see if she has a 2-to-1 ratio on her thorax. So she looks good. Her 2-to-1 ratio is in fact there. And then I'm going to do it on the front too. If you could just move your hair to the back. Thank you. So. And then we'll go to the right. Good. Good. Okay. All right. So her lungs sounded good. Her she didn't have any wheezing, no rhonchi in her lungs. They weren't coarse. They were clear. The expansion was fine. I'm going to inspect that actually again. So I'm going to place my thumbs on, sorry, can you move your hair again? You really love your hair. So I'm going to place my thumbs and my hands on the side of her rib cage and ask her to take a breath. And as you can see, my thumbs separate. Can you do it again? Just show the video. My thumbs will separate, showing that she has proper thorax expansion. I can also check it in the back as well. I'm going to move your hair. And then, so I'm going to place my hands the same way and ask her to take a deep breath. And you'll see her thumbs expand again in the back. So she has proper thorax expansion. Alright, so then we can check the tactile firmitis, I think it's called. So I'm going to place my hands over top of her chest, and then she's going to say 99.
99.
And you're going to feel a vibration on your hands, which is a positive sign. And then I'm going to do it on the back as well. So
99.
99, and you can feel it. And they can also say 1, 2, 3. But Bless you.
Thank you.
Do you have a cold?
No,
Oh, okay.
I'm allergic to.
Oh, thank you. Let's see. Oh. Okay. Recorder. Okay, yeah, it's recording. Alright, okay, so I'm going to auscultate. Oh, we did this. Okay, we did the breath sounds. We listened to your breath sounds over the back and front. Okay, so now we're going to listen to your heart. So we're going to listen for S1, S2. We're also going to listen for any abnormalities. You can put it in your lap. Okay, so we're going to listen to the aortic area. So it's up top, second intercostal down. So 1, 2. And we're going to listen with the bell of the stethoscope. We'll listen for a second. We're going to move it over and get the pulmonic area. Then the Arabs area is in the third intercostal. And the tricuspid is in the fifth. Down just a tad, I'm sorry. And in the mitral area. Okay. And we can hear them all, and we also hear that there's no murmurs, there's no sounds that we should not be hearing besides lub dub. And also we hear a diastolic, which is kind of sounds like a thunderstorm. It's like a whoosh, like the whole time while it's going on. You can hear that in S1. And then we're going to go down to, we did not hear murmurs. Okay, so we're going to inspect the jugular vein. So if you can just tilt your head back, we can palpate the carotid artery first. We feel it. We can lift it back that far exactly, and then just turn your head to the side. To like rotate your chin this way, like look that way. There we go. So we can see she doesn't have jugular vein extension here. So that's how we would inspect that. We would also inspect her pulses. So we'll have her brachial pulse, her put your arm out here, her brachial, her radial, her ulnar, her femoral up here, her popliteal down here, and then on her feet we have her posterior tibialis and her dorsal pedis. We would make sure that if we needed to, we would assess her pulses and all of them. So then we would do the Allen test after that. And the Allen test, if you could just place your hand on your lap, let me just make sure that the camera can see this a little bit. And we would occlude the ulnar artery. Tell Nicole to squeeze her hand tightly, and then open the ulnar, and then we would check the color of the hand. If the color of the hand stays, it means that she has good blood flow going through her hand. And I think we are done here. Okay.